Welcome back to our YouTube channel.
Keep in mind, this segment stretches over the course of 3 videos, so don't miss out on the last video when we upload it next week. Also, if you haven't already, go check out our last video linked over here.
As we did last time, we used the information we gained from a simple survey we conducted to notice what the public knows about anxiety. So today we are going to be covering effects of depression and ways to cope.
It is important to note that there is no 100% sure way to prevent depression. However, these strategies may help. Take steps to control stress, to increase your resilience, and boost your self-esteem.
Reach out to family and friends, especially in times of crisis, to help you weather rough spells.
Get treatment at the earliest sign of a problem to help prevent depression from worsening.
And consider getting long-term maintenance treatment to help prevent a relapse of symptoms.
It is possible to self-diagnose yourself with depression, but it is best if this is done professionally by a doctor. One factor their diagnosis can be based on is a physical exam. Your doctor may do a physical exam and ask questions about your health. In some cases, depression may be linked to an underlying physical health problem.
They can also find results through lab tests. For example, your doctor may do a blood test called a complete blood count, or test your thyroid to make sure if it's functioning properly.
Psychiatric evaluations are also very common. Your mental health professional asks about your symptoms, thoughts, feelings, and behavior patterns. You may be asked to fill out a questionnaire to help answer these questions.
Additionally, there is a DSM-5. Your mental health professional may use the criteria for depression listed in the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association.
Medications and psychotherapy are effective for most people with depression. Your primary care doctor or psychiatrist can prescribe medications to relieve symptoms. However, many people with depression also benefit from seeing a psychiatrist, psychologist, or other mental health professionals.
If you have severe depression, you may need a hospital stay, or you may need to participate in an outpatient treatment program until your symptoms improve. Here's a closer look at depression treatment options.
Medication is a common option. Many types of antidepressants are available, including the ones we will be shortly talking about. However, be sure to discuss possible major side effects with your doctor or pharmacist.
Doctors often start by prescribing a selective serotonin reuptake inhibitor. These drugs are considered safer and generally cause fewer bothersome side effects than other types of antidepressants. SSRIs include citalopram, escitalopram, and others.
Serotonin norepinephrine reuptake inhibitors, SNRIs, are also available.
Atypical antidepressants are medications that don't fit neatly into any of the other antidepressant categories. They include bupropion, mitrizapine, nefazodone, trazodone, and vitroxexine.
Tricyclic antidepressants include imipramine and nortriptyline and can be very effective. However, they tend to cause more severe side effects than newer antidepressants, so tricyclics generally aren't prescribed unless you tried an SSRI first without improvement.
Monoamine oxidase inhibitors like tranylcypromine and phenelzine may also be prescribed, typically when other drugs haven't worked because they can have serious side effects. Using MAOIs require a strict diet because of dangerous or even deadly interactions with foods, such as certain cheeses, pickles, and wines, and some medications and herbal supplements. Selegiline, a newer MAOI that sticks on the skin as a patch, may cause fewer side effects than other MAOIs do. These medications can't be combined with SSRIs.
There are also other medications. These may be added to an antidepressant to enhance antidepressant effects. Your doctor may recommend combining 2 antidepressants or adding medications such as mood stabilizers or antipsychotics. Anti-anxiety and stimulant medications also may be added for short-term use.
If a family member has responded well to an antidepressant, it may be one that could help you, or you may need to try several medications or a combination of medications before you find one that works. This requires patience, as some medications need several weeks or longer to take full effect and for side effects to ease as your body adjusts.
Inherited traits play a role in how antidepressants affect you. In some cases, where available, results of genetic tests done by a blood test or a cheek swab may offer clues about how your body may respond to a particular antidepressant. However, other variables besides genetics can affect your response to medications.
Don't stop taking antidepressants without talking to your doctor first. Antidepressants aren't considered addictive, but sometimes physical dependence, which is different from addiction, can occur.
Stopping treatment abruptly or missing several doses can cause withdrawal-like symptoms, and quitting suddenly may cause a sudden worsening of depression. Work with your doctor to gradually and safely decrease your dose.
If you're pregnant or breastfeeding, some antidepressants may pose an increased health risk to your unborn child or nursing child. Talk with your doctor if you become pregnant or you're planning to become pregnant.
Most antidepressants are generally safe, but the Food and Drug Administration requires all antidepressants to carry a black box warning, the strictest warning for prescriptions. In some cases, children, teenagers, and young adults under age 25 may have an increase in suicidal thoughts or behavior when taking antidepressants, especially in the first few weeks after starting or when the dose is changed.
Anyone taking an antidepressant should be watched closely for worsening depression or unusual behavior, especially when starting a new medication or with a change in dosage. If you or someone you know has suicidal thoughts when taking antidepressants, immediately contact a doctor or get emergency help.
Besides medication, psychotherapy is another option for those suffering with depression. Psychotherapy is a general term for treating depression by talking about your condition and related issues with mental health professionals. Psychotherapy is also known as talk therapy or psychological therapy.
Different types of psychotherapy can be effective for depression, such as cognitive behavioral therapy or interpersonal therapy. Your mental health professional may also recommend other types of therapies.
Psychotherapy can help you adjust to a crisis or other current difficulty, identify negative beliefs and behaviors, and replace them with healthy, positive ones, explore relationships and experiences, and develop positive interactions with others, and regain a sense of satisfaction and control in your life, and help ease depression symptoms such as hopelessness and anger.
Formats for depression therapy as an alternative to face-to-face office sessions are available and may be an effective option for some people. Therapy can be provided, for example, as a computer program by online sessions or using videos or workbooks. Programs can be guided by a therapist or be partially or totally independent.
In some people, depression is so severe that a hospital stay is needed. This may be necessary if you can't care for yourself properly or when you're in immediate danger of harming yourself or someone else. Psychiatric treatment at a hospital can help keep you calm and safe until your mood improves.
Partial hospitalization or day treatment programs also may help some people. These programs provide the outpatient support and counseling needed to get symptoms under control.
For some people, other procedures, sometimes called brain stimulation therapies, may be suggested like electroconvulsive therapy, ECT. In ECT, electrical currents are passed through the brain to impact the function and effect of neurotransmitters in your brain to relieve depression. ECT is usually used for people who don't get better with medications, can take antidepressants for health reasons, or are at a high risk of suicide.
There is also transcranial magnetic stimulation. TMS may be an option for those who haven't responded to antidepressants. During TMS, a treatment coil placed against your scalp sends brief magnetic pulses to stimulate nerve cells in your brain that are involved in mood regulation and depression.
In addition to professional treatment, there are also home remedies that can be used. These self-care steps can include sticking to your treatment plan, learning more about depression, paying attention to warning signs, avoiding alcohol and recreational drugs, and overall taking care of yourself.
Overall, it is seen that depression is an issue that must be taken seriously. Without proper precautions, which we will be discussing in our next video, there is a chance for more detrimental consequences that are life-threatening.
If you want to learn more about depression disorders and what it is on the more fundamental level, we will have more statistics and websites linked in a blog post on our website. We will be posting another video next week going more in depth about this issue.
Please remember that we are not professionals, and if you are dealing with an anxiety disorder or any other mental illness, please seek an adult or physician to confide in.
You can also call the suicide hotline at 1-800-273-8255. Don't be afraid to speak up.